Thank you very much, Ahmed, for the nice introduction. Like Ahmed said, my name is Wael Al Karim Muhammad Ahmed, and I'd like to pay tribute first in Arabic. نترحم على أرواح الشهداء بسورة ديسمبر المجيدة، ونتمنى عاجل الشفاء للجرحى والعودة للمفقودين. I'm just going to start sharing my slides. So today I'm going to talk to you about the December Revolution Center for Rehabilitation of Traumatic Spinal Cord Injury and Traumatic Brain Injuries. This is a project which was adopted by the Sudanese Doctors Union and is still underway. Like everyone said before me, Ahmed, Maysoon, Sarah, there were hundreds of major trauma injuries or polytrauma injuries, including traumatic brain injuries, spinal cord injuries, multiple open fractures, traumatic amputations, ruptured eye globes, penetrating chest and abdominal injuries, as well as burns. The number of deaths is debatable, but mostly reported as over 260. And we know there was also violence during arrests, mostly reported more than 1,200. The next slide is, I'm sorry for the populated slide, but I'm just going to try to explain. My source of data is mainly حاضرين initiative أو مجموعة حاضرين المتطوعين لرعاية الجرحى أثناء الثورة. The number of traumatic spinal cord injured patients, as you can see in the slide, there were 10. The mean age was 24 years. They were all males. They were mostly gunshot, 80%. Most of the injuries were in the thoracic spine, and mostly were paraplegics. In terms of the severity of spinal cord injury, they're mostly complete spinal cord injuries, which means that the sensation and motor function below the level of injury is lost. In terms of the specialist rehabilitation, as Sarah alluded before, there was some support in Sudan, especially for those who sort of have long-term prolonged disorders of consciousness in terms of nursing care. However, we know that we have very limited resources and we have no rehabilitation centers in Sudan at all, let alone neurological rehabilitation, and that's why we're making this project at the moment. So through connections, I started contacting colleagues worldwide, and I contacted a rehabilitation center, which is renowned in the CMCH Vellore, which is in South India. And we sent like 6 spinal cord injured patients who had mostly around 3 to 4 months period of rehabilitation, and they're back to Sudan. Unfortunately, 2 of those injured did not receive rehabilitation. One of them was actually very malnourished when we discovered about his injury. He was injured in the sit-in in the massacre, and he was taken to the security hospital, and he had treatment there, and then later on he was discharged home. So when we came to know about him, he was very malnourished. He needed lots of nutritional support, very weak, and right now he's running into complications. And actually, because of the COVID, we are not able to send any further injured victims. In terms of the deaths, 8 of them are alive at the moment. There's 2 deaths from, I'm talking about the deaths after the injury, not at the time of the injury. Unfortunately, we lost 1 patient who was injured in Al-Lubaid in 29th of July, which is the massacre in Al-Lubaid. And he was in a private hospital for a couple of months, and after he was discharged, sadly, he passed away 1 week later. There was another death, and this was a high spinal cord injured patient. He was injured in 25th of December 2018, and subsequently 2 weeks later he died. Unfortunately, in between he deteriorated in terms of consciousness, and he ended up with a possible hypoxic brain injury. It was not clear whether he actually had a traumatic brain injury. Eventually he died. Now, in terms of the traumatic brain injuries, there is reportedly 19 in total. The available records to me are around 6. The rest of the data we're still going through. These are possibly patients who were mildly injured. They didn't feature as severe traumatic brain injuries. So the 6 that we have, the mean age is 29. They were all males. 4 were gunshot and 2 tear gas explosion. In terms of outcomes, there is 2 of them minimal consciousness state, and 1 of them is a permanent vegetative state. 2 recovered their consciousness and walking ability. In a sense, they are able to do functional walking. And there is 1 death, and that's the patient who has both traumatic brain injury and spinal cord injury. So it's reported in both columns. In terms of specialist rehabilitation, only 2 of these received specialist rehabilitation in Cairo, and I visited them both in Cairo. It was in a center called Merkaz al-Dahil in Medina Nasr. However, the other 4 did not receive, mostly because they had sort of severe damage and they were only receiving care. In the next slide, I'm going to show videos for a couple of heroes from the spinal cord injury heroes, and I must say that I obtained consent to show their photos and videos. So the first one is a 23-year-old male. He was gunshot in Al-Gadarif, 19th of December. He had a mild traumatic brain injury. He's a C7 complete tetraplegic. He had a right clavicle fracture, so the wound or the bullet went through his right shoulder, through the clavicle into the spine and went the other way. He also was bedridden after the injury. He ended up with pressure sores. As you could see, he had a sacral pressure sore as well as a trochanteric pressure sore. We transferred him to CMCH Vellore in India on the 4th of June, ironically the day after the massacre, and he was discharged back to Sudan on 1st of October 2019. Ahmed, if you could please share the video.
Okay, just bear with me for a second.
معهم الدكتور عثمان عيسى من القضايف المصابين ثورة ديسمبر المجيدة. الإصابة كانت 2018 شهر 12 يوم 19 في القضايف. الحمد لله رب العالمين هسه كويسة. الحالة مستقرة تماما ما فيها وجه. بعد العلاج في السودان أخذنا رحلة إلى الهند، وحتى في الهند العلاج كان كويس شديد، يعني ما هي المشكلة. والله مشينا تعبانين لكن جينا والله كويسين شديد في أحسن حال. ما حتى العلاج هناك كويس شديد، علاج طبيعي ما عنده مشكلة. وأكثر حاجة بيعتمدوا عليها أنت لقيت إنه العلاج يكون طبيعي لا بكحات ولا بحاجات دي. وهسه احنا الفكرة السنين عنها دي والله كويس شديد، يعني بقت هنا في السودان بتسهل للناس كثير، أحسن من الناس تسافر برا وتكلفة كثيرة. هنا الفكرة بتاعت العلاج والمركز التعييني للعلاج الطبيعي هنا في السودان والله كويس شديد، والحمد لله. والله احنا مشينا تعبانين جينا كويسين جدا. هسه والله ما عندنا بالنسبة للحالات الأولى هسه والله هي بس تعسير بسيط في الحركة إن شاء الله، والزمن حاجة إن شاء الله. وهذا الحالة ماشية أحسن الحمد لله رب العالمين. الفكرة دي كويس شديد يعني. شكرا بارك.
Okay. Ahmed, if you stop sharing.
Okay, do you want to go back to your slides?
Yeah. So our next hero is again a 22-year-old male. He was gunshot in the Khartoum massacre, 29th of Ramadan. He's a T4 complete paraplegic. He was bedridden. He has pressure sores, as you could see. It was a necrotic sacral pressure sore, and he's got a left trochanteric pressure sore. He was transferred to CMCH Vellore in South India on 22nd of October 2019 and was discharged back to Sudan 14th of January 2020. Ahmed, if you could share, please, the video. Ahmed? Ahmed?
I'm on the case.
Sorry, can you hear me?
Yes, I can hear you.
صالح حسين 23 إصابة كانت فيها عدة أو يرى حادث. لا إصابة يفضل اعتصام ضربت بطريقة الشرف ولا بيجي وطلعت من قدام. كنت عملت عملية تثبيت بالمسامير وبعدها بشهر ولا شهرين مشيت الآن بعد التأهيل. فهنا كنت ما بقدر بقعد ما بقدر بعمل أي حاجة يعني بس زول راقد في الباب بحرك يمين ولا شمال وده رجالي يقول لك عندي 3 4 أنفار إذا مشيت هناك ولله على التأهيل حاجات كثيرة بقيت بعملها برا ومن الكرسي كويس السعيد ورجع الكرسي برا ولله تمارين توازن تمارين بتاعت حتى أنا لا أعرف هي هنا.
طيب من بديت أول أيام لما وصلت هناك الحاجة اللي بدوا لك باشنو؟
والله أول أيام كانت في دول حمام وبدأ لي البعد بدأ لي تمارين بتاعت التنمية مراكز أرفع حديد في تمارين ضم أصابع يقول عندي موضوع هذا يقول لي التمارين بتاعت الصلاة يقول لي التمارين بتاعت البعد وبعديها في التمارين بتاعت الكرسي يعني استخدم الكرسي ذاته.
Okay, thank you, Ahmed. I'm gonna carry on. Sorry. So the cost of rehabilitation for these heroes in CMCH Vellore in South India, including the flights, the transport inside India, was around $20,000 to $25,000 per person. But we also need to remember that once you have a spinal cord injury and a traumatic brain injury, unfortunately, you have these injuries for life. So all these injured heroes and victims, they require lifelong ongoing medical care, ongoing rehabilitation care, as well as equipment such as the cushions, such as the wheelchairs, and medical supplies such as catheters. Therefore, it is really cost effective to build a neurological rehabilitation center in Sudan. This table here shows the cost for spinal cord injured patients in the USA. For high tetraplegics, for the first year only, it's over $1 million. For those who are paraplegics, it's $500,000. And then each subsequent year, again, it's a lump sum of money. So it's really cost effective. So the next slide, Ahmed, if you can share this video, please, to give an example of what is a specialist neurological rehabilitation unit. I'm using the example of Greater Manchester Neuro Rehabilitation Services, and I pay tribute to my colleague, Dr. Raif Dahab, who is one of our rehabilitation medicine consultants in Greater Manchester.
Specialists in rehabilitation medicine not only treat and medically manage the complex patients with specialist knowledge, but also provide information, support, and counseling for the individual, family, friends, and carers. This helps them to understand the implications of the condition and maximize their functional abilities. We have a leadership role when it comes to managing the individual's care and improving the provision of neurorehabilitation services. We also have a teaching role to our team members and medical students.
We are responsible for reviewing and confirming the diagnosis and providing information around prognosis and recovery, medical and pharmacological management, management of sequelae including complex pain and epilepsy, overseeing care and liaising with other medical and surgical specialties if required, ensuring the safe discharge of patients and communicating with the GP for ongoing care.
Clinical neuropsychologists work with individuals, family, friends and carers to help them to adapt to or overcome their difficulties and better manage stressful situations. We help the individual's condition to be well understood and acknowledge changes that have occurred. Difficulties may be cognitive, including problems with memory or problem solving, emotional, including low mood or increased irritability, behavioural, including aggressive or impulsive behaviour out of character for the person. We may ask people to undertake tests to identify and understand their cognitive strengths and difficulties. We help the individual work towards their goals by providing education, psychological therapy, cognitive rehabilitation, or family support. We aim to improve quality of life for individuals by supporting them to regain their independence, return to work, and maintain positive relationships.
Ward managers manage the day-to-day running of the neurorehabilitation units, ensuring complex needs of patients are met. Staff nurses are involved in the direct patient care, including giving medications, taking neuro observations, meeting nutritional and bladder and bowel requirements. We communicate with patients and their families to offer support and guidance and work closely with support workers to meet the patient's personal hygiene needs. Specialist nurses have advanced skills in airway management and alternative feeding regimes. In the community, we help individuals to understand their neurological conditions, provide advice on medications, and monitor for health changes.
A speech and language therapist will see you in the neurorehabilitation setting if you are having difficulties with your swallowing or your communication. We may also be involved with working with the multidisciplinary team around the management and weaning of a tracheostomy.
Speech and language therapists provide individualised, in-depth assessments to look at communication, which may include speech production, language difficulties, and social communication problems. These difficulties may occur separately or alongside one another. Following this assessment, we may then provide direct one-to-one therapy, working with families and carers, therapy within groups, providing education. To help with communication, we may need to consider high-tech devices, for example, iPads or eye gaze systems. There are also lower-tech alphabet charts to facilitate communication. We also help with communication around more formal decisions, such as mental capacity assessments.
When working with swallowing difficulties, we may advise on optimal positioning.
Thank you, Ahmed. I'm just going to carry on with the presentation. Right, so the December Revolution Center for Rehabilitation of Traumatic Spinal Cord and Brain Injuries is planned to be a free lifelong medical and multidisciplinary rehabilitation care for the December Revolution victims. And we are also going to manage all spinal cord injury patients and traumatic brain injury patients. It's just the free lifelong medical and multidisciplinary rehabilitation care is planned for the injured victims, as the main source of funding is coming through fundraising from the Manchester Committee, which is aimed for supporting the revolution victims. However, the center will also support the development of the neurological rehabilitation specialty in Sudan. It will also provide a platform for training postgraduate and undergraduate doctors in rehabilitation medicine, as well as the training of postgraduate and undergraduate allied health professionals, including nurses, therapists, dietitians, and psychologists. So the proposal was first written in October 2019. I'm very grateful for the SDU UK to adopt the proposal from day one. The executive committee commissioned the funding of the project by 173,000 in January 2020. After that, we consulted the Federal Ministry of Health, and they allocated the Director of Curative Medicine to follow the project with us. And after that, we opened the application for hospitals to host the project. And the executive committee consulted a Rehabilitation Medicine Advisory Committee, who are my colleagues that I work with. We are 4 consultants from UK, 1 consultant from Australia, 1 from Saudi Arabia, and 2 consultants from Sudan. We had the first meeting as a specialist group on 18th of January 2019, and 2 of our senior colleagues were delegated to carry on the visits in the host centers in Sudan, as well as continue the process and carry on the options appraisal. And eventually, we had a meeting to finalize the recommendation of Soba University Hospital to host the project. And this was submitted to the executive committee, who approved the recommendation. And we were sent an email confirmation by the Federal Ministry of Health by mid-June to approve the project. After that, the advisory committee had a meeting with the engineer, and we were talking about the design of the buildings for a specialist rehabilitation center. That was in July. Eventually, we developed a steering committee for the project, and that was end of July. The steering committee, I'm going to talk about it in details in the next slide. But in terms of the timeline, we have received a concept design and cost estimate submitted by New Tech Consulting Group to the steering committee in mid-September. So these are the groups forming the steering committee. We've got the SDU UK represented by the President and General Secretary, Soba University Hospital represented by the General Manager, Dr. Shaddad. We also have the specialty groups, the Rehabilitation Medicine Advisory Committee, as well as the Sudanese Physical and Rehabilitation Medicine Association. We also have the government ministries, the Federal Ministry of Health, represented by the Director of Curative Medicine, and the Federal Ministry of Social Development and Care. And we also have an IFADI charity group who are very interested in the project. In terms of the update, the steering committee had 3 meetings up until now. There's actually another meeting happening in a couple of days to push forward the project. There is an engineering committee which was established to communicate with New Tech regarding the proposal and finalizing the design and agree the costs. In terms of the finance, there is a committee established to gather charity funds headed by an IFADI charity group. There is also a memorandum of understanding which has been exchanged between the SDU UK and Soba University Hospital. It has not yet been finalized, but we are in the process to agree how to spend the funding by the SDU UK with Soba University Hospital, which is mainly for the equipment. We just need to have a legal document. In terms of the specialty groups, meetings are ongoing. We had a meeting as a Rehabilitation Medicine Advisory Committee a few days ago. We're planning outpatient clinics for the injured victims, as well as workshops, conferences, and training, hopefully at the start of the new year. In early February and in March, there will be conferences and workshops underway. Just going to show a quick clip to explain the design of the center. It's a silent clip. So this is the parking area outside the center. And as you go in towards the main entrance, you can see this is the front and the main entrance of the December Revolution Rehabilitation Center. You can see some wheelchairs on the side. It's like a parking area for the wheelchairs. This is the main entrance and the reception. And then along, this is a waiting area for patients. This is the reception. Along the corridor on the right side, there is rooms for outpatients clinic. On the left side, there is rooms for storing medicines and pharmacy. And towards the end, there is the physiotherapy gym on the right side, and occupational therapy gym. This is the reception of the ward. There is patient rooms on either side of the reception. And this is the other exit going into an open area. So I'm just going to share a nice memory that I had, and I'm very thankful to Hadreen, Nazim Siraj, to have the opportunity of meeting one of our heroes, Colonel Hamid, who defended the injured at the crackdown in the first week of April 2019. I must pay tributes to the Sudan Doctors Union UK branch for adopting this project and giving me the opportunity to fulfill one of the dreams to improve the neurological rehabilitation services in Sudan. I would like also to pay tribute for the group, which is MDT for Injured Heroes. This is a group of mostly diaspora consultants, along with consultants in Sudan, that is up until now has been looking after the injured victims, as well as daily discussing the cases, as well as scans. So thank you. We also need to pay tribute for Hadreen Initiative, who provided this data and provided me the opportunity to help the injured victims. And lastly, but not least, my colleagues from the Rehabilitation Medicine Advisory Committee, Dr. Salwa, Mr. Rahid, Dr. Raif, Dr. Aladdin Al-Malik, Dr. Hanan, Dr. Ahmed Saad, Dr. Sati. Thank you very much for helping and still continuing to help with this project. Thank you.
Thank you, Wael.